Today's ICD-10-PCS quick coding tip will focus on when you should and when you should not code lysis of adhesions when performed alongside another procedure. My name is Claire and I'm an inpatient auditor and educator. In my quick tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. When coding procedures in PCS, one of the most difficult aspects is not necessarily the actual coding of the procedure, but rather determining whether the procedure should be coded at all. Determining whether lysis of adhesions should be coded is a common area where coders often struggle. Adhesions are fibrous bands of scar tissue that form as the body heals from tissue damage, which might be caused by surgery, injury, trauma, or radiation, and they're most commonly found in the abdomen and pelvis. Normally, internal tissues and organs have smooth surfaces that allow for easy movement within the body. However, adhesions disrupt this natural movement by causing tissues and organs to adhere to one another. One common complication of adhesions is a bowel obstruction. This can happen when adhesions bind loops of intestines together, attach them to nearby organs, or even anchor them to the abdominal wall, resulting in displacement of the intestinal sections. Lysis of adhesions, also known as adhesiolysis, is a surgical procedure that involves cutting or breaking down the adhesions. This procedure can be done as treatment for a bowel obstruction or to relieve other symptoms caused by adhesions. Adhesiolysis can also be performed incidentally during other surgical interventions when adhesions are encountered during the surgical exposure. Lysis of adhesions is coded to the root operation release, which is defined as freeing a body part from an abnormal physical constraint by cutting or by the use of force. During this procedure, some of the restraining tissue may be taken out, but none of the body part is taken out. The body part value coded is the body part structure being freed and not the tissue being manipulated or cut to free that body part. For example, if the operative report describes that a laparoscopic lysis of adhesions is being performed to treat a bowel obstruction, and during surgery, extensive adhesions tethering the small intestine to the abdominal wall are taken down, the appropriate body part is small intestine, since the objective of the adhesiolysis in this case was to free the small bowel from the abnormal constraint by releasing the abnormal connections that the adhesions had established, tethering the intestine to the abdominal wall. The listing of lysis of adhesions in the title of an operative report does not necessarily mean that it should be coded. Abdominal adhesions are frequently encountered during surgical procedures of the abdominal or pelvic region, and surgeons generally will lyse any adhesions that they might encounter when entering the abdomen. Coders should not automatically assign codes for lysis of adhesions based solely on the mention in the report. Just like with other surgical procedures, the presence of adhesions or documentation indicating lysis in the operative's title is not a determining factor for coding purposes. For adhesiolysis to be coded separately, both the adhesions themselves and the procedure to lyse the adhesions must be clinically significant. This typically requires that the adhesions have an association with the patient's diagnosis or pose a challenge during surgery, making the procedure more difficult. When lysis of adhesions is the main procedure performed, both the diagnosis of adhesions and the procedure for lysis should be coded. This includes situations where adhesiolysis is the sole procedure performed, when it is done to alleviate a bowel obstruction, and when it is performed to address the patient's symptoms such as pelvic pain caused by adhesions. When lysis of adhesions is performed in conjunction with another procedure and the surgeon has indicated both the clinical significance of the adhesions and the complexity of the lysis, both the diagnosis of adhesions and the procedure for lysis should be coded. This includes situations where the surgeon documents the adhesions as extensive, dense, massive, numerous, or other similar terms, and the adhesions are obstructing or otherwise prevent surgical access to the target organ and must be lysed for the primary procedure to proceed, as well as any documentation as added complexity, such as they required tedious, meticulous, or extensive lysis, took a significant amount of time to lyse the adhesions, or added increased difficulty to the procedure. Let's take a look at some examples that demonstrate when you are able to code for the lysis of adhesions, when you should not code for them, and when it is appropriate to submit a query. The operative report lists the procedures performed as a laparoscopic total hysterectomy and lysis of adhesions. The summary of findings indicates that there were dense adhesions. The description of the procedure describes that after the laparoscope was placed, the surgeon encountered dense adhesions and carried out an extensive lysis of adhesions that took greater than an hour to clear the peritoneum for trocar placement. In this case, the adhesions were described as dense, which indicates the clinical significance of the adhesions, and the lysis was described as extensive, taking greater than an hour before the surgeon could even carry out the planned hysterectomy. The surgeon has documented both the clinical significance of the adhesions and complexity of the lysis, and so an additional code should be assigned for the lysis of the adhesion. In this next example, the operative report lists the procedures performed as a laparoscopic total hysterectomy and lysis of adhesions. The summary of findings indicates that there were adhesions from prior abdominal surgeries. The description of the procedure indicates that the laparoscope and trocars were placed, and some adhesions were encountered and transected. Although adhesions were present and lysed, there was no indication by the surgeon that the adhesions were clinically significant or added any complexity to the procedure, and so the lysis of adhesions would be considered a routine step necessary to access the surgical site and would not be coded separately from the main hysterectomy procedure. In this last example, the operative report lists the procedures performed as laparoscopic total hysterectomy and lysis of adhesions. The summary of findings indicates that there were dense adhesions. The description of the procedure describes that after the laparoscope was placed, the surgeon encountered dense adhesions and performed lysis of adhesions to clear the peritoneum for trocar placement. In this case, the adhesions were described as dense, which indicates the clinical significance of the adhesions, and the lysis was described as being done for trocar placement. However, the documentation does not indicate that it was extensive or added extra time or difficulty to the procedure. Because the documentation suggests that this may have been more than just a routine procedural step, but is not entirely clear, a query would be warranted to clarify whether the lysis of adhesions was clinically significant and added complexity to the procedure. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding!